how comfortable are you with your own immunity and titers that hang around measles kids?
No, I had measles.
Oh, you had it?
Yes. I mean, I'm of an age where I was born before 1957.
Oh, got it. So you cheated and got measles. So you're saying, okay, I'm just going to go on record here and say Paul Offit says have a measles party, everyone.
Vaccines are the best of two worlds. What they do is they induce roughly the same immune response that would induce by natural infection without having to pay the price of natural infection.
True. That after being naturally infected with measles, I probably have higher frequencies of memory immune cells, B and T cells, than does someone who was vaccinated. Yes, I do. That's true.
Because you had a bigger antigen response.
Yeah, and the virus reproduced itself thousands of times in me, and not the 10 or 20 times it is when you get the vaccine. So I have a much greater immune response. It's true.
You never really say MMR doesn't cause autism, but frankly, when you get in front of the media, you better get used to saying it, because otherwise people hear a door being left open when a door shouldn't be left open.
Right.
Wait, I'm sorry. Could you repeat yourself? Just one more time.
You can never really say MMR doesn't cause autism, but frankly, when you get in front of the media, you better get used to saying it, because otherwise people hear a door being left open when a door shouldn't be left open.
Right. In 1988, 69% of all school-age children in the U.S. who contracted measles were adequately vaccinated. 69%. In 1989, 89% of all school-age children in the U.S. who contracted measles were adequately vaccinated. 89%. In 1995, 56% of all measles cases in the U.S. occurred in people who were previously vaccinated. 56%. So I just wanted to point that out.
So as a pediatrician, you wouldn't deepen your knowledge of molecular biology or the brain or other things like that. That would be referred out to another specialist. For example, if you saw a child with a concussion or you saw a child with some kind of brain injury, you wouldn't treat that, would you?
No, it's in other words, what I am is I'm Chief of Infectious Diseases here at Children's Hospital of Philadelphia, and so what we do here in the Infectious Disease Division is we see children who are inpatients who have severe or chronic or persistent or unknown infectious diseases, or we see children as outpatients who generally are referred by pediatricians in the community with an infectious disease that they're having difficulty handling.
You know, the real problem with people like Dr. Offit, they have no training in toxicology at all. Medical doctors do not receive training in toxicology to the extent that would qualify them to comment on whether or not an injection of a certain amount of a toxic chemical like the aerosol or mercury in the body would be toxic. They're just not trained to evaluate that.
Vaccines are the best of two worlds. What they do is they induce roughly the same immune response that would induce by natural infection without having to pay the price of natural infection.
That's just totally not true. There's a big difference in the immune response between a natural infection and getting an injection. For example, if you get injected with the measles vaccine, you can get the measles. People do. If you get the measles, if you get it naturally, you'll never get the measles a second time.
So best of both worlds. You get the immune response that will protect you against a subsequent measles challenge, but you don't have to pay the price of measles infection, which can be a high price.
I had measles.
Most Americans want to believe that that's the case, but the bottom line is in the United States, we vaccinate earlier and more often and for more diseases than any other country in the world, yet we have the highest infant death rate of the 43 most modern countries. We're at the bottom of the heap with regard to being able to protect our children. And I think a legitimate question to ask is, if our vaccines are preventing infectious diseases and deaths from infectious diseases, what are American children dying of that make them have one of the highest infant death rates in the world?
It's certainly true, actually, that if you look at diseases like whooping cough, or even to a lesser extent diphtheria, you start to see some decline as we got, better sanitation, better hygiene in our country. But you didn't start to see a dramatic decline in virtual elimination of those diseases until we introduced vaccines.
I think he's totally wrong, and the data shows that he's not correct in that assumption. We saw the major drops in death from many infectious diseases, say starting at 1900, when they started keeping records, 1900, 1910, until about 1940, 1950. Those rates of those diseases dropped dramatically. Before the vaccines were ever introduced, they dropped over 90%. And so the bigger drops were before the vaccines were produced.
This chart of deaths from pertussis, or whooping cough, is from Vital and Historical Statistics of the United States from 1900 to 1968. It shows a dramatic decline in deaths from pertussis well before the pertussis vaccine came into widespread use in the 1940s. the death rate falls from as many as 17 per 100,000 in 1918 to less than 2 before the vaccine came into widespread use in the late 1940s. This chart of New York City mortality rates tracks infectious disease from 1880 to 1911. It shows that deaths from diphtheria, the blue line, fell precipitously from a high of 175 deaths per 100,000 in 1882 to less than 25 by 1911. Deaths from the croup also declined dramatically during the same period, yet there is no vaccine for the croup. This chart of United States mortality rates shows that continued deaths from diphtheria had fallen below 15 per 100,000 before the vaccine was introduced in 1920. Pertussis fell from as many as 16 per 100,000 in 1907 and 17 per 100,000 in 1919 to fewer than 1 by 1951. The vaccine was in use from the 1940s, but sizable drops occurred well before it was introduced. Measles, the green line, fell to less than 2 per 100,000 in 1940, a full 25 years before the vaccine was first introduced in 1963. Typhoid, the dark blue line, and scarlet fever, the red line, also declined dramatically over the same period without a vaccine. This graph shows the decline of all 5 diseases. Some declined before a vaccine, others declined without one.
Well, you know, when you talk about how much money the vaccine program costs the American public, we're spending billions of dollars on vaccines. And maybe we would be better served if we took that billions of dollars and spent it on hygiene and good food, and maybe the availability of antibiotics in certain areas. Because I think antibiotics and hygiene have done a lot more to reduce the amount of infectious diseases in this country than have the vaccine program.
And so I live in Philadelphia and therefore feel compelled to quote Ben Franklin whenever possible, but an ounce of prevention is worth a pound of cure. And that's always true. You'd much rather prevent something than to try and have to treat it.
Well, I agree with that, and I'm trying to prevent infant deaths and sicknesses